pregnant women. And what are the fallacies which we need to appreciate is that the observer has to be fully trained, and we can't rely on an untrained person to record the blood pressure measurements in a pregnant lady, especially the one in whom you're suspecting hypertension. And patient should have rested for at least 10 minutes before the measurement, and correct cough phase 1 will be taken as systole and correct cough phase 5 to be used as diastole, measuring respectively. And the arm cuff size should be at the level with the heart, and approximate size of the arm cuff with the length, that is 1.5 times the circumference of the upper arm, should be used. And please understand the fact that we need to take 2 measurements 4 hours apart to say that this patient has got hypertension, and we need to make a patient sit and then measure the blood pressure, especially if she's pregnant. This is to see that we catch them early, because in the sitting position, the gravid uterus compresses the big vessels of the abdomen, as a result of which the BP will be high. And so, on a lying down position, this takes off, as a result of which the BP may show a little lesser. But then if the BP shows a little higher in the sitting posture, it is still fine, because we'll be able to catch them earlier and start treating them earlier. So we rather over-treat them rather than under-treat them. That is the first thing. The second thing is that you need to understand that in pregnancy, women tend to put on weight, and in preeclampsia, women tend to become little obese. And so when they do that, there is an obese patient, and you can't use the same correct cough, same Raaonline cuff and measure the same correct cough sound. On the other hand, we can use the leg cuff on the arm, and then we can measure the blood pressure. And white coat hypertension, to be kept in mind that when a doctor comes to see a patient, after the patient comes in a very tense situation and you measure the BP as 140/90, please do not label them as hypertension yet, because we need to measure one more measurement as, and another important thing is we will have to keep the tension or the labile hypertension or the white coat hypertension as well as in mind. The pathogenesis is huge in preeclampsia, and if somebody wants to get a Nobel Prize, this is the field of research. But then we have so many theories and so many speculations about why some patients develop preeclampsia and why some patients don't develop preeclampsia. But the sine qua non or the basic factors here, that there is a poor placentation and there is placental oxidative stress, and that's the first phase of